So I get a patient comes into my office, Winbill. And Winbill comes in and he says to me, I'm having trouble with rage. And I go, well, what's going on? Let's talk about it. Because, I'm worried I might be bipolar, blah, 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 blah. And I'm talking to him. And he comes in and he's pretty bulky. Looks like he's been lifting a lot of weights. And I'm talking to him, and it's about a half an hour into the session. And he mentions to me, well, I'm using testosterone. I'm like, well, okay. Tell me about that. Who's prescribing that? Oh, no, I'm buying it at the gym. And you're buying it at the gym, how much are you doing? Because I'm doing 200 milligrams every 2 days. He's injecting testosterone cypionate every 2 days. And he's been doing that for about 3 years. So I'm talking to him. I'm like, Winbill, do you ever think that might be a problem? He goes, no. So I say to him, the max dose there is 400 milligrams, and that's for someone with virtually no gonad function. That means someone who produces no natural testosterone. So he's somewhere, 1,200, 2,400 milligrams every 2 weeks, the max for someone with no testosterone production, and he was absolutely normal. So he would be way above normal, 6 to 10 times the normal dose. And he said, well, I'm having these rages where I go into these episodes where I lose control of myself. I just start yelling and banging on things with my wife. I said, okay, the steroids are the problem here. He goes, no, it can't be. I said, no, it's the steroids. I'm pretty sure. He says, it's probably bipolar. I'm like, no, these steroids are a problem. And he's holding on to it. And I'm like, hey, Winbill, whoa. He's addicted to the steroids. He doesn't want to give them up. It's like denial. It's euphorogenic. I mean, they get you, I wouldn't call it a high, but an exhilarating, positive feeling, an energized, almost super powerful feeling. I'm talking to Winbill. I said, Winbill, you notice your hairline's receding? Oh, yeah. Yeah, his hairline was receding. That's why I brought it up. And I was like, have you noticed? I said, that's what steroids do. They cause receding hairline in men. And I said, have you noticed like acne on your back and oily skin? He goes, oh, I've noticed that. And I said, they make you real argumentative and angry. And they even cause people to become psychotic. Oh, I'm not psychotic. I said, but in our conversation, you're always worried about people at the gym and people trying to destroy your business. Maybe you're getting a little paranoid. Oh, I'm not paranoid. And I tried to explain to him, I said, when you're getting paranoid, you don't know you're getting paranoid. And he had all these deep meanings and making these deep connections, why people would be after him and why government agencies would be tracking him. And I'm like, this guy was in the nursing home business, and he wasn't even running the nursing home business. He was providing services to nursing homes. It wasn't like he was involved in any government agencies. The nurses contracted with him to bring in ancillary services to nursing homes, and it was a pretty big business. He was fairly successful. And I'm talking to him. Have you noticed anything else, like possibly breast enlargement? A little bit, but no big deal. He says, my muscles got bigger, I got lean, my endurance increased, I felt trimmer, I felt more energetic. I said, you notice when you did cardio you couldn't breathe? Well, maybe. I said, Winbill, you need to be aware that there's something called androgenic erythrocytosis. What does that mean? That means you have increased red blood cells in your blood, and your blood becomes thick, viscous, like oil. because you have so many red blood cells, it's tough for your heart to beat. It's tough for your lungs to get oxygen. So when you do cardio, you can't breathe. I said, were you noticing that? He says, yeah. I've noticed when I go running, I can barely, I used to do triathlons. I can't do them anymore, but I can lift much more weight. Yeah, because not only is it making your blood like oil, it's making your heart wall, left ventricle, right here, that big ventricle of your heart on the left side that does most of the pumping of the body. It makes it so it gets real thick. So instead of having a thin elastic pump that pumps in and out, you get this thick wall that can't pump. It enlarges the left ventricle wall. It causes hypertrophy to get thickened so much you can't pump. Now, with all these factors going on, it also causes hypertension. He goes, oh, I have hypertension. I'm on medicine for that. Did you tell the doctor using steroids? No. I said, the hypertension leads to kidney disease. He goes, really? I said, you think you look good on the outside, although you're balding, you have acne on your back, your face, your skin is oily, and you're growing tits like a woman. And not only your testes, you shrink and become small, and you have trouble when you cycle off with erection. Have you noticed any of that? Sure, I have. But I said, internally, you're destroying your body. And he goes, really? Now I've got his ear. Now he's listening. I said, yeah. It causes hypertension. It causes atherosclerotic plaques. What does that mean? The arteries in your heart fill up with fat plaques or plaques, and you can't push blood through the arteries, and eventually they clot off because it's like a tunnel where it's being filled with muck, and slowly there's not enough room for blood to flow through it, and you get a heart attack. Oh, I didn't know that. Yeah, well, the steroids decrease HDL, which is the good cholesterol that helps keep your arteries open. It raises LDL, which causes the plaque to build up. It causes hypertension, which makes this worse. It makes you prone to heart attacks and strokes. It makes your kidneys malfunction, so you have too many red blood cells, so then you get hypertension in your kidneys. Now your kidneys are trying to pump with hypertension, which kills them. The viscous blood from all the red blood cells, which kills them. Your kidneys shut down, your heart shut down, you get heart attacks. Well, he goes, that's not good. Now remember, with all this bad stuff going on, the little vessels in your body don't pump blood as well because they're clogged, they're hypertensive. So the little vessels that feed your hips go out, and your hips die because you get avascular necrosis, the little vessel that feeds the big ball in your hip. You know that there's a little bone in your big hip bone, the femur. Hello. The blood supply gets occluded, and all these steroid abusers wind up with hip problems, heart problems, kidney problems. It's pretty bad. Not to mention, you build your muscles up beyond what your body can handle. You build them up, but your ligaments and tendons don't get built up. You lift really heavy weights, you get ligament and tendons get damaged. You get muscle pains. It's all from the steroids. And then he says, well, I use SARMs, the selective androgenic receptor modulator. So it's just basically like a steroid that's been altered to minimize some of the side effects. Don't play that game either. They're just as bad. Your body does not like these drugs in excess. There may be some use for them with people with anemia, with people who have wound healing problems, a temporary use, people with HIV or cancer who don't want to eat and are muscle wasting diseases for short periods at regulated doses, fine. Okay, there are some uses. So you'll take that ambiguity, and all my patients out there, AKA Justin, it's not really his name, but he uses it as his code name. This is for you. Not to mention, you become sterile. Let's take that. Justin, Henry, Louis. I've got Olympic weightlifters coming here. I've got professional athletes coming to this office. Yeah, you get sterile. You get breasts. Your testes shrink up. You have problems with erection. It decreases sperm production. These drugs are not good when abused. I don't even like them in athletes when they say they're cycling on and off. No, it causes permanent damage. Heart, kidneys, tendons, ligaments, not to mention cosmetically, acne on your face, your shoulder, your back, you be bald, you grow breasts. They say, well, I minimize the breasts. I use inostrogol, which is an anti-estrogen, because testosterone breaks down to estrogen. And so if you use an anti-estrogen in someone who's abusing testosterone or testosterone-like drugs, you won't get the breast enlargement. That's true. I'll give you that. But I have these athletes, and they go, oh, no, I need it. Yeah, you're addicted to the high, the performance, the cosmetic enhancements. You get these big muscles and you're loving life. And these young guys say, well, look at all the good it's doing me. Blah, 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 blah. Their testes shrink up even when they're young. Sperm production goes down and eventually stops. They're doing permanent damage to the ventricles, the heart, the kidneys. They're causing hypertension, which has a host of other problems. They're predisposing them to heart disease, heart attack. It's not good. Did I miss anything? That you become delusional, you go into rages. You know what one guy do? I guess I could say on some road in Palm Beach County, he was also paranoid because they make you psychotic and you won't see yourself becoming psychotic. So he stopped at a red light. I don't know what he was doing, but when the light changed green, the car behind him honked. He lost it. And the car kept honking, and for whatever reason he didn't go. He gets out of his car, and it's a green light. He's got a golf club. He starts banging on the guy's car with a golf club, and he didn't stop. Eventually, they called the police. The police came, and they had to subdue him because he was out of control. And then he caused such a scene in the emergency room. Unbelievable. I mean, he was all black and blue. His whole sides from them kneeing him, and he was totally inappropriate. He deserved it. You know, I know some people don't deserve it. He was trying to hit the police officers for absolutely no reason. He was arguing with the nurses for no reason. His wife finally came. It took him hours to calm down. He wanted to be a Mr. Olympia. He was bench pressing. He was my size, 5'10", 190 pounds. Bench pressing over 400 pounds. His chest was out to here. It's ridiculous. Then I have another one who's a small man, and he keeps lifting these weights, and he went into kidney failure. And he said, oh, it's not from the steroids. It's not from the steroids. Yeah, right. You know, it also causes immune suppression, so you don't fight off pathogens like viruses, like COVID-19, like bacteria. It causes delay in wound healing. What did he do? He went into kidney failure. Oh. Then I had someone who had a heart attack and died. He was 25. I have a 45-year-old man who's going into kidney failure. Then I had the one guy who, the roid rage, the psychosis, he wound up getting a felony charge because he was beating people up, like the police in the emergency room. Oh. Then I had another one who stroked out. Then I got Justin out there who's young and nothing's going on him now. But just because you can't see what's going on doesn't mean the steroids aren't destroying you. They are destroying your organs. You know, it also causes liver damage, fatty liver, damage to the liver. It's not pretty. When I follow these people long term, they don't do well. Oh, and when I stopped the guy who came to my office recently, there is a steroid withdrawal. Headaches, drowsiness, decreased appetite, weight loss, fatigue, depression, dizziness. Oh yeah, they don't, it's a mess when I get them off, especially when they do the high dose. There is a withdrawal. It takes 2 to 4 weeks, and they're miserable, cranky, irritable, kind of obnoxious people to deal with when they're in withdrawal. I use benzodiazepines, things to help them sleep, anti-anxiety. I sometimes have to use antipsychotics, to tell you the truth, because they all don't see themselves drifting to the abyss of psychosis. Everyone thinks psychosis is hearing voices and seeing things. Yeah, well, that's part of it. It's a spectrum. What about misreading events in reality? Those people are talking about me. Those people are plotting against me. I think those police officers are here to get me. Or those people are talking and they're planning something against me. Or these workers are not working because they're all in a plot against me. There are very faint forms of psychosis. It's a spectrum. Hearing voices and seeing things, disorganized speech and behavior is the extreme. But there can be the unextreme. Misreading, over emotional response to normal events, thinking people are plotting. These are the fine, soft signs of psychosis. So I'm a total not a fan of this whole gym thing of growth hormones, SARMs, testosterone. With all this said and all the damage that I said, they're doing high protein diets, creatinine. Another thing these steroids do is that they retain sodium. They cause fluid retention and bloating and edema. So when you fly on planes and you're a young guy, your legs swell up, your face swells up, your hands swell up. You notice your rings don't fit. You have pitting edema where you press on your ankles and it forms a little indentation that doesn't go away. Yeah, that's from retention of fluid and sodium from what's called the mineral corticoid effects of these steroids. There's also a suppression of glucocorticoids, the body's natural response that breaks down muscle. It blocks those. It increases the mineral corticoid, the anabolic effect. And I get why it's addicting. You could work out, you lift more, your muscles are bigger, your endurance are bigger, you can go longer, your recovery time is bigger. But all the bad, it's not worth it, people. Please. This practice is all young people. It's probably from age 10 to 30, most people. And these are the ones who start with these steroids, and it's usually a one-way trip. Once they start, they get into that, I'm Superman now, and they don't stop. And then I deal with them when they're 45, 50, and that's when the kidney shuts down. That's when they get heart attacks. That's when they have degenerative disc disease from lifting too heavy weights. Their ligaments and tendons go. They become sterile. They can't have kids. They have heart problems, kidney problems. What gets them is the heart and kidney problems. That's what kills them. Thank you, Dr. Mark Agresti.